perfect. So we are being recorded. We're going to go ahead and move on. Welcome to all of you who are just joining us. We just did some reminders. We will be posting this PowerPoint at a later date to the DDAP website, so you can always take a look at it at a later date, and it is being recorded. All right. So to go through the agenda here, you'll see that we're going through quite a few different topics today. So we have different presenters who are going to be talking on different topics, and you're going to be meeting those presenters here in a second. But we are looking forward to updating you on a variety of. So in terms of who's going to be presenting today, so we have partners from DDAP and DHS we're very excited about. And I know that we have a lot of partners on the call today from payer entities and single county authorities and treaty. From DDAP, we have Erica Noko, the Director of Bureau of County Program Oversight, and Tim Rader, the Chief of the Training Division and the Division of Program Support and Quality Improvement. We have Mary Hickok, Program Representative from the Division of Program Support and Quality Improvement. And you all met me a little bit before, and I'm getting some notes here that audio is going in and out. So just if you can hang with us for 1 minute here. Okay. Hopefully that's a little bit better. Can everybody hear me okay? Yeah, is that better? Perfect.
Yes.
Okay. Excellent. Thank you. Very sorry about that. So those are the folks from DDAP who are going to be presenting. And then from DHS, we have Benny Verghese, Division Director from the Program Management and Planning with OMSAS, and then Barry Decker, the Division Director with Program Development and Policy with OMSAS. So very excited to have our partners with us today. In terms of the overview and purpose of the call, so basically the purpose of this call and the reason why we wanted to kind of start a monthly meeting like this is to make sure that everybody was getting the most up-to-date information about ASAM alignment. And we really wanted to provide a forum in which all entities that are directly involved in ASAM alignment were in one room. Today's meeting is going to be more of everybody giving a very high-level update about what's going on with ASAM alignment, particularly during this extension period that goes until the end of December. Future calls will really be providing trainings and guidance on certain ASAM alignment topics. And so we really look forward to that in the future. All right, so we're going to go ahead and jump in here. So the first update that I want to give everybody is that we have spent the summer, when I say we, I mean the quality improvement team at DDAP, has really spent the summer updating the ASAM alignment website. So we spent several months auditing the materials and the resources that were on that website because we understand that this process started all the way back in 2017. And there were some resources and some documents that were a little bit outdated. And so we wanted to make sure that we, removed certain documents and then we provided new updated documents that provide the best resources available to the field. So we really spent several months doing that. And we are right at the tail end of that process right now. And we will be adding some additional resources, and we're continuing. So here are some of the specific, tasks that we did when we were updating the website.
Excuse me, Kathleen, I think at least I couldn't hear you for like a few seconds. I don't know if there's still an audio problem or not.
Okay, let me just see if we can. You know what I think I'm going to do is I think we might have to stop recording. I don't know if that is the issue, or I can try to change my audio source. Give me 1 minute here.
Sure.
All right, everybody. Hopefully everybody can hear me. Yes?
Yes, we can. I could hear you well, but in between for a few seconds, about 4 or 5 seconds, I couldn't hear a word. So, but then you're back now. Yeah.
Okay. All right, everybody, we're going to continue to go on. Apologies about the technical difficulties that we're having. This will be able to be viewed at a later date on the DDAP website if there's anything that you, in fact, missed. And again, apologies about that. So here are the ASAM alignment website updates. And then again, here is the ASAM website that you can locate here. I encourage all of you to take a look at the most updated information. In terms of newer parts of our website, you'll see here the areas with stars next to them are areas that are newer to the website. So you'll notice the ASAM alignment memorandum, the list of the 2.5 and 3.7 aligned facilities. I mentioned that some of the documents that are a little bit older in nature, those have been archived here, so you can locate them here. We have an updated training section, and Tim is going to be presenting next, and he will give us some more updates on the exciting things that's happening in the training division. And then we have a new section, the ASAM historical documents section, which is at the bottom of the website. And again, we are going to be adding as we complete the updating of these documents. So with that, I'm going to turn it over to Tim Rader to give us some more information about ASAM related trainings and updates.
Thanks, Kathleen. Hi, everybody. The next couple slides, again, my name is Tim Rader. Thanks for the intro, Kathleen. I'm the training section chief at DDAP. The next couple slides are just really a reminder of the available training regarding ASAM that we have. The first slide, foundational ASAM training, is a requirement for all those doing assessments. And this training is done, as many of you know, through Train for Change. It's a company outside of DDAP. The registration happens on the Train for Change site. They often post opportunities throughout the year for individuals to register for the 2-day ASAM criteria training. Also, an option are on-demand modules created by the change companies. Access modules 1 and 2, which is part of the requirement. We can send out after, of course, after this a meeting. Also on our website are instructions on how to access both of those trainings. Motivational interviewing, if you could, there you go, thank you. Motivational interviewing is a course developed by DDAP. It's also a requirement for clinical supervisors, case managers, and clinicians. It's highly encouraged that the 2-day or the foundational ASAM requirement is taken prior to the motivational interviewing training. This training occurs both in classroom and virtually. If it's in the classroom, it's over the period of 2 days. If it's virtual, it's a little more complicated, so we've had to stretch that 2-day content out over 5 sessions if it's done virtually. And these trainings can be accessed through the DDAP training management system. If you have an account in that system, log in and look for opportunities on the schedule. If you have difficulty, please contact the DDAP training section. We can certainly send out contact information for us afterwards. And then we have a new training regarding treatment planning in the ASAM criteria. So person-centered, action-oriented, strength-based treatment planning is discussed in this training. Treatment plans that are rooted in the ASAM and in an ASAM multi-dimensional assessment. So far, we've piloted about 6 of these of the new training. Feedback has been great. We continue to improve based on that feedback. But this is an example of the supportive trainings that that complement the foundational ASAM criteria training that we require for the field. And we continue to work on adding to this catalog to support the transition. Thanks, Kathleen.
Thanks, Tim. All right, and I'm excited to turn it over to my colleague, Mary Hickok, to talk to us a little bit about the adolescent ASAM alignment.
Good morning, everyone. So the adolescent ASAM alignment is going to be a multi-phased approach, and I'm going to explain that in a little more detail in the next slide. There's going to be a guiding group, which will inform the ASAM transition process. And this group is composed of adolescent providers from across the state, irrespective of their level of care. It will also have some state agencies and ad hoc members that will be present as needed. Kathleen, can you go back to the previous slide? Wasn't quite ready. So the transition process is going to start with the 3.0 level of care, and then every 6 to 8 weeks, another level of care will be rolled out. DDAP is currently looking at the number of providers at the other levels of care to determine which level will be next. And if you have any questions, comments, thoughts, or suggestions, I would encourage you to email the RA account. And if you don't mind going to the next slide, I'll tell you a little bit about the overview of the process. So the next slide kind of summarizes the anticipated alignment process. There may be some fine tuning that occurs, which will be based on any feedback from the guiding group. And the length of each step will really depend on the number of providers that offer the service at that specific level of care. So for the 3.0 level of care, we're going to be getting information out to providers, and that will be done over the course of 4 to 6 weeks. And then providers will have about 6 months to make any needed changes. And DDAP will provide individualized support as needed. And then DDAP is going to obtain feedback over about an 8-week period to really hear from providers about how the transition process has been going. Based on feedback, additional guidance may be issued. And if that additional guidance is issued, it will be done over the course of 4 to 6 weeks. It'll be done through virtual meetings, emails, and documents put on the website. And then providers are going to have about 6 months to make any changes. And again, DDAP will be there to provide technical assistance as needed. Thank you, Kathleen.
Thank you, Mary. Very excited about the adolescent alignment process that's up and running. We're going to be moving on now to talk about the withdrawal management section. This is a very brief slide today, but just wanted to give you an update since several individuals had some questions about this. So over the next several months, DDAP is going to be adding additional resources on withdrawal management to that DDAP ASAM alignment website that I just showed you. And those resources are really going to be coming directly from the ASAM section of the text focusing on withdrawal management. So for those of you who are interested, that's pages 128 through 143 of the ASAM text. And if you're itching to familiarize yourself with withdrawal management, this is where you're really going to want to be focusing, and we encourage you to take a look at this section of the text. And then some of you have had some questions about the alignment process for withdrawal management. And we want to make it really clear that DDAP is considering those facilities that are inpatient, non-hospital, and hospital detoxes, as we're considering them as substantially aligned at this time. In terms of ambulatory withdrawal management, DDAP is currently reviewing and gathering information. And as soon as we have some additional information, we will let you know through these calls and also through the website, along with some SBA correspondence as well. All right, so right now I'm pleased to turn it over to our colleagues at DHS. So Barry Decker is going to be presenting on co-occurring disorders, and I will turn it over to him.
Okay, thank you. Thank you, Kathleen. Good morning, everyone. So we have an opportunity to work together collaboratively on a particular bulletin. Obviously, we want to focus on different areas of the ASAM and co-occurring. So keeping in mind, individuals with co-occurring mental health and substance use disorders are about 7.7 million adults. Of the 20.3 million adults with substance disorders, 37.9% also had mental illness, and among the 42.1 million adults with mental illness, 18.2%, also had substance use disorders. And this is things that have occurred nationwide. And that's really where our focus needs to be. Individuals with co-occurring. So my next slide, sorry. What I'm doing is I have my screen up here, what you have on here. So I have some notes on there. So I apologize. Okay, so I'm where you're at now. So DHS and DDAP are working collaboratively on developing a bulletin to address requirement of ASAM. There was a previous bulletin that was put out there. It was actually called, or it was the OMSAS 0603, titled the Co-occurring Disorder Competency Approval Criteria for all facilities licensed by the Department of Health Division of Drug and Alcohol Program Licensure, or the Department of Public Welfare Office of Mental Health and Substance Abuse Services. That is a mouthful. So I'm glad I was able to get through that. So thanks for bearing with me on it. That particular bulletin was issued in February of 2006. And like I said, that was something that was occurring then, and now we're working to revise that. We will work at replacing that because of ASAM coming in and providing new criteria to follow. So particularly, what are we going to get out of it? Or what are we doing with it? We're going to be announcing the co-occurring enhanced services that are to be provided in accordance with the criteria. Also, we're going to issue requirements for a co-occurring enhanced program. Just to go over it again, as far as like co-occurring enabled or enhanced. So these programs will have a focus on integrated care. So that's really what we're trying to look at, that integration of care that's occurring. All right, next slide, please. Okay, so also the bulletin will provide guidance on establishing the quality care delivery system for treatment of individuals presenting with co-occurring mental health and substance use disorders. So we should be able to lay those things out. Also, it'll outline the need for the co-occurring enhanced services. So to enhance the use of multidimensional assessments, also that they will assist in the identification of co-occurring conditions and the delivery of services that will result in the development of person-centered treatment outcomes. What's nice is that with the ASAM, with the focus on the child and adolescent, they've been using the ASAM criteria since 2006. And now, as of July 1st, 2021, ASAM has been being used on the adult population. So it's really not something new that we're going to be coming out, but we're going to be able to provide those guidelines that you guys will be able to use. Okay, next slide. So outcome expectations, obviously adolescents, adults, and young adults shall be treated using with the ASAM criteria. Okay, programs should assume that individuals coming into the SUD treatment program are likely to have co-occurring conditions and needs. I think this is very important. We need to look for those things. All programs must have an adequate service system to either assess and refer the co-occurring capable to appropriate mental health services or provide services to individuals diagnosed with co-occurring disorder to ensure the best clinical outcomes, the co-occurring enhanced. So we make sure that, there again, you have what you need to be able to get these individuals the services, and also utilize the clinical knowledge, clinical practice, and public policy to address the needs of the individual instead of placement. We want that focus to be on that individual, not just getting them into some type of program where everybody, is the same, and that just doesn't work. So we're trying to work on his individual needs. Next page. So the completion of the bulletin, we're trying to anticipate around mid-spring 2020. Like I said, we're working very hard. I know even through the collaboration, what's interesting, we're trying to walk through the steps on how different pieces work. And I think that's always the challenge. So like I said, hopefully look for something around mid-spring 2022. Okay, so the only thing I can say is that once again, regardless of when the bulletin comes out, obviously, folks should be using the ASAM criteria right now. So it's being currently used. And that would be it. So thank you, Kathleen.
Thank you, Barry. Yeah, thank you. I appreciate it. And I just want to mention before we move on to the monitoring piece that DDAP and DHS are also currently working together to update the co-occurring training that's being used right now for the field. And so we are actively working on that, and we're going to be very excited to make that public probably in the next couple of months or so. So obviously, once that is done, you will receive notice about that. Please be looking on the website and on your listservs. But this training is going to be new and improved, and we're very happy to be launching this. So thank you, Barry. We appreciate your update. And I am going to be turning it over now to Benny Verghese and Erica Noko, who are going to be talking a little bit about the monitoring process that's going to be occurring with the ASAM alignment. So Benny, it's all you.
Thanks, Kathleen. Can we go back to the first slide where there was no content? Yes. I think we're going to stick to this slide for a couple minutes before we move on to the next slide. Again, thanks for the introduction, Kathleen. I'm Benny Verghese. I'm with DHS's Office of Mental Health and Substance Abuse Services. So as Kathleen mentioned, in the next few slides, we're going to be talking about monitoring for ASAM. But before getting into any discussion about what this monitoring entails and how we'll be doing it, I want to make sure that our partners and stakeholders on this call know why we are monitoring for ASAM. I think it's important to know that. With that said, I'm pretty sure that almost everyone on this call has heard about our 1115 SUD waiver. So it is this 1115 SUD waiver or demonstration that was approved by CMS. It is this 1115 that has allowed us since, I believe, July of 2018 to draw down federal Medicaid dollars to help us to provide services to individuals in certain settings, certain residential settings that come under the definition of what we call an institution of mental disease or an IMD. And most of our SUD residential services fall under this category. So I just want to make sure that folks are aware that okay, this is a mechanism, the 1115 waiver is a mechanism through which we are able to get those federal dollars to provide these much needed services to the individuals who most need it. And we do draw down millions and millions of federal dollars every year for this. So while that's a really good thing, and it also comes with a lot of requirements that CMS expects the state to comply with. And, so failure to comply with those requirements could potentially jeopardize the waiver and, could stop the flow of federal dollars to the Commonwealth, which in turn is going to impact our ability to continue to provide services to the individuals who most need it. So there are many requirements associated with this waiver, the 1115 waiver, that we have to satisfy to the feds. But for the purpose of this discussion, since we're going to be talking just about monitoring for ASAM, I'm going to focus on 3 items, I believe, that are directly tied to ASAM. So Kathleen, we can move on to the second slide. So these among the many requirements that we have to satisfy, these are the 3 requirements that are tied directly to the implementation of ASAM. The first one is access to critical levels of care. So we're talking about levels of care like outpatient, intensive outpatient, residential levels of services, the broad area of all residential services, withdrawal management, MAT, either you provide that on-site or by facilitating access to off-site. And I think I mentioned withdrawal management and, of course, inpatient hospitalization. So we had to make sure that this access to these critical levels of care that are aligned to ASAM are available. That's one of the requirements of the 1115 requirement, 1115 waiver. The second one is the use of evidence-based SUD-specific patient placement criteria. So in the context of our waiver, that evidence-based SUD-specific placement criteria would be ASAM. So I just wanted to make sure that folks are aware of that. The third requirement is that is the use of nationally recognized SUD-specific program standards to set provider qualifications for residential treatment facilities. Again, when we're talking about nationally recognized SUD-specific program standards, we are talking about ASAM, and the way we have in our ASAM application and the ASAM implementation plan that CMS approved. And there are a few items specific to this requirement that are clearly laid out in the special terms and condition of the 1115 waiver. The like things like credentialing of staff, the number of clinical hours for each level of care in residential and other settings, and also the types of services that you would provide in each of those various different LOCs. So these are the ASAM specific requirements that are part of our 1115 waiver that the Commonwealth is required to comply with. So we need to demonstrate to CMS that we are in compliance. And how do we do that? And the way we are able to do that is obviously through monitoring. I mean, so that is the mechanism or the process that we will employ to let CMS know that, hey, these are the requirements, and we are going out and we make sure that our providers are meeting those requirements. So essentially what I was trying to say is, what I was trying to give you is a background, a reason why we are doing it, and and how we can meet those requirements that CMS has tied to the 1115 waiver. So monitoring is the only mechanism and through which we can demonstrate that to CMS. The next slide, it has, you see, as some of the core tasks associated with the monitoring related to the previous slide that we just discussed. So these tasks are going to help us, again, demonstrate to CMS that, yes, we are in compliance with what we have asked you to do. And that would make sure that we would continue to be able to receive those much needed federal dollars for the service needs, to meet the service needs of the individuals who most certainly need it. And if you want to take a quick look at it, the various tasks are, one is determining that the alignment with ASAM has taken place in accordance with the ASAM criteria. We are to ensure that all the providers are enrolled with our medical assistance program appropriate to the ASAM LOC. We'll be developing a monitoring process as one of the tasks. And developing tools, various tools. I mean, to look at the infrastructure, to look at the medical records, to make sure that providers are in compliance with what CMS has asked us to look for. I think with that, I come to the end of slides. I believe, Kathleen, I have, and I think Erica is now going to talk a little bit more about the monitoring tool.
Thank you very much, Benny. I greatly appreciate you reminding us why we have to do monitoring. Hi everyone, this is Erica Noko, the Bureau Director at DDAP for County Program Oversight. Today I just have the one slide for you, but it really is to give you an idea, a high level overview of the layout and structure of the ASAM monitoring tool. Over the next couple of months, you'll be getting more details provided to you about the tool and the monitoring process. So please be aware, heads up that more to come on the monitoring tool as well as the monitoring process that will be sent out by DDAP. There will be a separate training specifically on how to use the tool. So again, in the next couple of months, we'll have those for you so that you're aware and you understand what the tool is, what's on the tool, and as well as how to implement the tool. I have to emphasize, this is very important that you keep in mind that when we are talking about monitoring, we are looking for evidence. We're looking for evidence that the providers are moving in the right direction to align with ASAM. So this isn't an all or nothing. Really, when we're talking about monitoring, especially with a new process that is this large, this much of a transformation, we're really looking to, identify that providers are going in the right direction. Finding out what assistance that they may need in order to implement ASAM, finding out what that specific information is so that we can provide guided technical assistance to everyone, to all of our stakeholders on the call, so that we can move in the right direction with monitoring and implementing ASAM. The tool, as it's currently set up, is divided into a couple of pieces, two pieces. So the first part of the tool is what we're identifying as an infrastructure review. So what does that mean? Really, that means that we're looking at examining policies and procedures that are in place specifically as it relates to ASAM. We are not looking to do a duplication of what licensing does for you. This infrastructure review is really focusing in how your policies are aligning with ASAM so that clients can receive the best quality service of care. So the infrastructure review is really a step one. After the infrastructure review, then you would come up with what we're calling or identifying as an application review. And in that application review, we're looking at two pieces. Both of these pieces can be done at the same time. So it's not like there needs to be multiple visits to a provider. Really, the application piece consists of an interview and a record review. So the interview would be coming to the provider, having a discussion with the provider about your policies and procedures and what you currently have in place, kind of verifying that infrastructure review, reminding everyone that is involved in the monitoring process of, hey, here's what was outlined in the infrastructure review. Let's have a conversation about it. Is there anything that you need assistance with or help with, or anything that we really should know prior to starting the second piece, which would be the actual record review? So the record review is quite literally that. We would be pulling client file records to look at, and the tool has specific designated questions that we would be looking at to see that your policies and your procedures are being appropriately implemented. And we know if that is being implemented, then our client individuals are receiving a nice, good quality level of care for each particular ASAM level. So the two-part process for the application review, the interview, and the record review, again, as I said, can be done in tandem with each other. Again, I will go back and emphasize this is a process. This process is something that does not happen overnight. Everyone on this call is willing to work to provide technical assistance, any help that you may need. We are not looking at this process as a gotcha process. We are looking at this as something that we all can use a good, solid, quality assessment to help our clients get the services that they need. So more to come. That's just, again, a high-level overview of what the tool is. We will be giving out more specific instructions within the coming months of the directions for monitoring as well as implementation of that tool. Kathleen, I will now kick it back to you.
Thank you, Erica. And thank you, Benny, both of you for updating us on the monitoring process. All right, so we just got through a lot of material in 40 minutes, and I just want to go through a couple of items before we wrap it up today. First of all, I want to just say thank you for everybody for sticking with us. I know there were some audio issues throughout the call today. I do want to reassure you that if you missed anything, the PowerPoint and the recording will be available on the DDAP website. It's probably going to take us a couple days to get it up there, but it will be up there. So if you had staff that were not able to attend and you want them to kind of hear about what's happening with ASAM alignment, they can definitely have access via the DDAP alignment, ASAM alignment website. I also just want to remind you that we do have a couple minutes left, so we're not going to be answering questions live today. And I saw a bunch of people with their hands up, and I appreciate you doing that. But we can accept questions through the chat today, and then our quality improvement team will respond back to your questions via the ASAM email accounts over the next 7 to 10 days. So there still is time to type in questions in the chat. I did see a couple questions come through, and thank you for submitting those. I will leave this room open for a couple of minutes so that people can submit questions if they want to. And that is it for housekeeping. Our next technical assistance call is going to be on November 1st at 10 a.m. If you want to forward the invite to other colleagues so that they can attend the next call, please feel free to do so. And the topic for the next call is going to be navigating barriers for implementing MAT at all levels of care. So, we think it's going to be a very helpful presentation. Our licensing and treatment division is going to be the ones leading that call, and they have a really helpful presentation that they will be putting together. So with that, the last thing that I just want to mention, as Erica spoke about during her section, we have a team that is devoted to ASAM alignment. And if you're having struggles, or if you just need to ask questions or get clarification, or you're at a loss for something, we are available to provide technical assistance. And we really would love to do that. So please reach out to the ASAM email account to request technical assistance. And if you just have general questions, you can reach out to the ASAM account as well. We have somebody who's always having their eyes on that account, and we want to be of assistance, particularly during this extension period, which goes through the end of December. So that is the end of the presentation today. Again, I am going to be leaving this room open for a few minutes so that people can submit their questions to the chat. And I want to reassure you that our team, the quality improvement team, will be responding back to your questions over the next 7 to 10 days. So with that, I am going to say thank you for joining us today, and we will hopefully see you on our next call in the early November 1st. Thank you.
Thank you. Bye.
Again, I'm going to be leaving the chat open, so if anybody wants to continue to submit questions through the chat, please feel free to do that.